Hello, and thank you for joining us for this episode of Growing Bright Futures. This series, Growing Bright Futures, is brought to you in partnership by Tree Levin and the Addison County Building Bright Futures Regional Council. This informational series will be featured on Middlebury Community Television. The broadcast features local experts discussing the importance of early, quality childhood experiences for Vermont's children and harnessing the power of Vermont's communities to improve child and family well-being. The series will be available to stream and download at middleburycommunitytv.org and Building Bright Futures social media platforms. I'm Darla Senecal, Building Bright Futures Regional Manager for Addison, Rutland, and Bennington counties. Cheryl Mitchell is usually our host for this program, but today she's in the interview seat. I'm also joined by Dr. Jody Brakeley and Dr. Barb Frankowski. Good morning.
Hi, Darla. Thanks for having us.
So please tell us about the Early Care and Learning Partnership. How did it come to be? And tell us what you see for this program.
I might start with just a quick overview and then turn it over to Dr. Frankowski for a little background. Many of us in the early care and education fields knew a woman named Paula Duncan. She was a pediatrician who believed very strongly in strength-based approaches. As she was coming near the end of her life, we held a gathering in her honor with pediatricians from across the country. And one of the things that we heard as a way that we could potentially honor her was to allow pediatricians to prescribe early care and learning programs for the families that they thought it would help. And we thought it would be very easy. So I recruited Dr. Brakeley and Dr. Frankowski, and we went to Medicaid and said, could you give us a code so that pediatricians could do this? And they said, no, we need more research. So we got into a much more complicated project, but it's been really fun, and we've added a few board members along the way. I'll tell you about those later, but I'd love to just ask Dr. Frankowski to talk a little bit about Paula. This is sort of named or subnamed the Paula Project.
I'd love to. Dr. Paula Duncan was a wonderful pediatrician and an amazing person. And as you mentioned, Cheryl, she championed the strength-based approach and initially really focusing on adolescents and encouraging healthcare providers in Vermont to help adolescents identify their strengths and build resilience. And then I always say Paula was a very broad thinker, and she went both upstream and downstream. So upstream with the thought that today's adolescents are tomorrow's parents, hopefully not that quickly, but sometimes. And downstream, looking at the fact that adolescents who struggled often grew up in families that struggled. And so if those families help earlier on, things might be better for the adolescents. So Paula really started to champion family strengths. And that's where we really took that inspiration for this project. And as you mentioned, before her death, we had the celebration of strengths, and that people were just sort of creatively thinking of ways that we can put strengths to work in Vermont. And so this project was born, honoring Paula and her broad view of strengths and family strengths.
Thank you very much. Can you tell us, Cheryl, who makes up the board and the staff of the Early Care and Learning Partnership?
Great question, Darla. So actually, we're a virtual organization and we have no staff. So that one is very easy to answer. All of the work that we do through working partnerships with other organizations, such as Building Bright Futures. And you are one of our most esteemed and valued board members because, as Dr. Frankowski mentioned, we try to focus on the strengths of children, the strengths of families, and building the strengths of communities. So we really see Building Bright Futures as focusing on the strength of communities. Another board member is Linda January, who's the director of the Otter Creek Children's Center. She's also the co-director of the Addison County Child Care Directors Association. She has a deep history with this community, and we have been grateful that she has the on-the-ground experience right now. The rest of us here are taking care of grandkids from time to time, but we're not doing the day-to-day childcare work that Linda is doing. And then Catherine Torres, who was the co-founder of Shine Literacy in South Africa, a program really that matched adolescents with young beginning learners and was very, very successful. She's now a consultant to the Addison County Parent-Child Center. So we've been very grateful that she's on the board too. Dr. Brakeley and Dr. Frankowski will introduce themselves, but we also have 4 really wonderful advisors. I'll just mention them quickly. So Kay Johnson, who's probably the national expert on children's Medicaid, but fortunately lives here in Vermont, has been helping us tremendously. Beverly Bourget from Let's Grow Kids, who's their healthcare liaison. Kim Kaiser, who has held probably every position known to childcare, from a caregiver to director of the child care services to outreach to consultant, and she's now the program director for the Turrell Fund. So they have, and Ann Collins, who is on the board of Porter Hospital. So our connections with the healthcare community and the child care community have just been strengthened. So, and we hope actually never to have staff. We're hoping that everything we do, we can do by supporting other organizations.
And I would say it's been a successful model so far.
So far, yeah.
Can I ask, when did this group come together? Can you answer that question?
Technically in January of 2019. So we met at the Parent-Child Center. Kay Johnson did an overview about Medicaid for children. Many of us were there, and we've been going ever since. We meet usually on the phone. We also have no staff and no physical location. So we live on the internet, and we live in the projects as they're unfolding.
How very modern.
Yes. And sometimes we meet on Jody's, Dr. Brakeley's back porch.
So you talked about the connection between childcare and healthcare. I know that there have been meetings between pediatric caregivers and some of the directors and those in childcare in Addison County. Dr. Brakeley, can you tell us a little bit about how those meetings came to be and what they consisted of?
Well, it just made sense that if our mission was to try to get Medicaid to use some healthcare dollars for early care and learning opportunities, that our bond with the medical community be stronger. And it is sort of intuitive. You'd think, oh, of course, the early childhood community and those providing care, medical care for those children would be closely affiliated, but we've learned that it's not that easy. It seems that people are just so busy in their day-to-day work that it doesn't happen unless you create opportunities for that. So one of our earliest things was to meet with the University of Vermont Health Network, Porter Department of Pediatrics, Women's Health, and the Birthing Center to kind of share what our thoughts were and find out, well, we didn't want to just say, oh, this is our great idea. We wanted to ask people, how does it sound to you? And can you make suggestions for improving the idea and the approach and whatnot? So that was the beginning, and we've had several meetings with them ongoing. We also keep up our connections with the UVM Health Network Porter administration, so the CEO and the CMO and community people there. So that's really important that we meet to share what we're doing in our vision. And those connections have been really useful. One of the times that I can think of that comes to mind is during COVID-19, when the health guidelines were changing almost daily, and there was a lot of concern for health and frustration and fear even. And so having an opportunity to have the healthcare community and the early childhood community in the same Zoom room to share their experiences and ideas. And that was a useful thing. And I think that we just want that to grow and go forward.
So there are plans for that to continue, for those meetings to continue on a somewhat quarterly-ish basis, I believe.
You know, we don't have anything scheduled like that, but the desire is there. The early childhood educators say, well, we could meet and talk about certain topics, and the medical community says, well, we could meet and we could maybe think about making clear our own guidelines and whatnot. So I think there's a lot of room for those ideas to bloom.
Thank you. How does the Early Care and Learning Partnership support the childcare community?
So I'm a little bit sorry that Catherine Torres isn't here with us today, but we take turns attending the directors' meetings. One of the things that we learned early on was this is an industry that needs a huge amount of support in terms of wages and benefits, in terms of professional development, in terms of helping to create more childcare spaces, because parents are frantic when they can't find a place that they feel safe having their children, and we simply don't have enough spaces in the county. So in going to those meetings, Catherine has often helped the directors to work together to draft position statements, to share information with the wider public about the need for care. We've been very fortunate to have Middlebury College students, some last year. You'll hear about them in terms of the research we were doing with parents. Two wonderful women this year who are helping us to understand what the child care needs are. So I think that we're a cheerleading squad as much as anything. And then we do have the capacity to really help get things written and get them out and distributed through the public education channels. And we love them. We love and respect and admire them, which I think is something really important in that field.
Absolutely. I can tell you by my experience, especially over the last year, that it's a group that has worked tirelessly for kids and families. And, you know, we're deemed essential, you know, to come back first, you know, to work when the shutdown happened, and to have the support of a group like Early Care and Learning Partnership, I feel is very important to those folks in Addison County.
We might jump in and say, we're also working with Linda Murray, who's not on the call today, but and Middlebury College and some other people, but many members of the ECLP board are helping to craft, design, and create a large new childcare center for Addison County. So we're each bringing our different expertise to that project.
That's great. Cheryl, can you tell us a little bit about the MA and the BA program, the master's program that you have going on?
Yeah, this is my current obsession and passion. One of the things that we realized was that we need to grow our own really skilled caregivers and people that will be the leadership for the early childhood community. So we decided, working with Castleton University through their Center for Schools, that we could create a 7-course certificate program called the Policy and Practice of Nurturing Care, which really shifts things from the traditional way that people have been looking at early childhood to say whole child. So not just health, but mental health, social emotional health, cognitive development, spiritual development, creative development. So whole child, whole family, really working with the 2 generations at the same time, and whole community. The 7 courses have already been offered. There are 3 of them taking place right now at the Castleton Summer Institute. I just finished one, and one of the astonishing things is that the women in this program, people can take it for undergraduate or graduate credit. We are learning so much from them about what it really takes to have that dream of whole child, whole family, whole community be implemented. It's very easy to say the words, and it's an interesting challenge. And they are on the ground also in terms of dealing with the equity issues that became so evident during COVID. So people can still, the next course coming up is Dr. Brakeley's course, and Dr. Frankowski will be a guest speaker on human development. So looking at neurological, cognitive, social, emotional development. That will be in the fall. There'll be a leadership course that Sue White and I will be teaching. And then a spring course, again on human development, but with a focus on making meaning and creativity and how people come to express what they understand and believe about the world. It's been incredibly fun. And I should put in a plug to say it's half the cost of a usual Castleton course. So we've been given this amazing gift by Castleton University to do this. And people now, because of the new APR, American Rescue Plan funding, can take their undergraduate programs into a BA, or once people complete the 7 courses at a graduate level, they can transition seamlessly into a master's degree at Castleton.
And these classes are being offered virtually, is that correct?
Yeah, it was not our original plan. We all thought, oh, this is going to be a sweet cohort model. We'll all get together, we'll share meals. And then COVID came and we had to be online. And actually the gift of that is that one of the courses that David Murphy is offering this summer, I believe there's people from other states as well. So the idea of being able to share the nurturing care model with people on beyond Addison County it's been forced upon us, and I guess we're glad.
Thank you. Dr. Brakeley and Dr. Frankowski, can you speak a little bit about the experience sharing groups that took place? I believe it was during COVID that those happened.
I'll just do a little introduction to that, and that's that as the Early Care and Learning Partnership, we're really interested in what families truly need and want for their early childhood care for their children. And that number, and the essence of that has been very difficult to get at. There are numbers available, but largely they're based on an equation, which is the birth rate in your community times the percentage of people in the family who are thought to be working. So it's 70 or 72%. So they come up with a number, but it doesn't tell us that nitty gritty of what do you really want? Do you need something for the swing hours? Do you work weekends? Do you work nights? Do you work only part days? Or would you like to only work part days? So we really wanted to know what families wanted. And so we came up with the idea of experience groups or focus groups and surveys. And I'll let Barb talk about what we really found when we were listening to them.
Sure. We had actually 2 very different groups. One was a father's group, and one was a group of very young parents. And I'll just go over what I thought was the most striking things that I noticed, and then I'll let Jody mention what she thought. But from the father's group, it was very interesting because people really wanted to do what was best for the children, and in that case, several of those fathers had foregone their career or taken a break from their career when COVID hit, so that they could take care of the children. But they talked about how important it was to have quality care that they felt very comfortable with. So it was beyond just safe and reliable, but they really wanted it to be high quality. And then when the pandemic hit, having to make those very difficult decisions of what's going to happen. And at the time that we had it, we were just sort of looking at the next stage of COVID and what was going to happen as far as care. A lot of it was outside and trying to make the best of it. But those fathers were very committed. And then what struck me with the young parents was how connected they were with their child's pediatrician or healthcare provider. And again, it was hard to get people to think outside of COVID because, that was what your world was at that time. But they were the parents were very adamant and well-spoken for themselves of being able to contact their child's pediatrician. They just didn't want to talk to any old, healthcare provider in the emergency room or whatever when their child was sick. They had that really strong relationship and wanted to talk with their child's pediatrician who knew them. And these were families who had wonderful childcare because they were in the part of the parent-child center. So they didn't have to worry about they knew they had high quality childcare. So that was taken care of. They were mostly concerned about, being able to talk with their child's own pediatrician when they had a question or a problem. And, so those were the things that struck me the most. And Jody, I don't know if you had any other thoughts that you wanted to share about that.
Well, there was another group as well. There was a mother's group that Cheryl actually conducted. But I just wanted to say that what I heard from that and from the surveys was that the way that we learn what's available for childcare is that system could really be improved on. That to sign right now, what it is you sign up and you get on everybody's waiting list, and then if you're really motivated and you really are dire, you need to have care, then you call every day or twice a day and you just try to make your presence impressionable. And so what we heard back was that there's got to be a better way to do that. So I think that's part of what we're working on, we're interested in, both in surveys and for future experience groups. I think Let's Grow Kids is working on that. BBF is interested in that. And Cheryl can speak a little bit more to what the other experience group was like.
So the other experience group, as Dr. Brakeley said, was mothers, and it was all mothers who had been working full time. Suddenly COVID came, everything shut down for them. And a lot of the concerns that they expressed were, how do you know what's going to be a safe setting in terms of health? Not in terms of whether kids are being taken care of or not, but are the COVID protocols being followed? A fair number of the moms talked about deciding to create pods with other friends so that they would know the children and the families that their own child was interacting with, and they would hire a caregiver to come and be with that group of kids. So that's a new area that we're beginning to look at in Vermont. I think the other thing people were concerned about was the pressure that's on working mothers if somebody in the office needs to be out and you're not allowed to hire substitutes to help with that workload. So the workload gets spread amongst all those people that are still there. So it makes the issue of, even though many of the bigger organizations in our county have maternity leave on the books or even paternity leave on the books, people often feel as if they can't take it because of the incredible pressure that it will put on the rest of their colleagues at work. So that was I hadn't really thought about that. And then, go ahead.
Well, just to go along with that, during COVID, we're listing all the silver linings that are possible, but one of them is that we saw a greater interest from the business community in offering more flexibility, which is what families say. One person said, what got me through this is because of blah, blah, blah. So some flexibility that some employer or some boss had. And so I'm sorry to interrupt, Cheryl.
No, and that leads right into my next question, was the connection with economic development and business community. If you could speak a little bit to that.
I can talk about that a little bit because we got to, as representatives from the early childhood community, we got to be on the recovery task force of Addison County's Economic Development Council. And it was really an opportunity when the schools were first shutting down, when all the childcare programs closed, for the business community to talk about what they needed. And it brought up, as Dr. Brakeley said, this issue of maybe we as business community need to be more flexible. Maybe the 9-to-5 job, or the you cannot work from home when suddenly everybody is now working from home. Employers were really open to rethinking that. and also frustrated in the same way that Dr. Brakeley mentioned that parents are, that you can't just say to your employee when you're recruiting, and this will be a great place to work because you'll be guaranteed excellent childcare. So it's an issue that we're carrying forward now. We had talked about working with the administration of the UVM Health Network at Porter. We've also met a couple of times now with the administration at the counseling service of Addison County. And they are the home to something called shared services, where we're really trying to say, could we do some of these things in partnership rather than as independent little, most of the childcare programs in our county are little nonprofits, independent nonprofits. And the beginning to address this wait list problem and maybe having a single wait list so families only apply once. Maybe we'll eventually move towards something like the states that have universal pre-K, where people simply apply and say, these are my top 13 choices, and my top 13 choices, we wouldn't have that luxury, but I think that there's movement in making things better for both parents and also for employers.
Great. So my final question for all of you is, what is the long-term vision for the Early Care and Learning Partnership?
Do you want to take that first, Barb?
Sure. I think in a perfect world, in an ideal setting, to have high quality early care and learning, easily accessible and affordable for any family that wants it. I think that again, another silver lining of the pandemic has gotten us to sort of think more creatively about what that could look like. The idea of the pods where families get together and share it, or whether it's at a centralized location, in a big facility or a home. But I think the main things are easily accessible, affordable, high quality, and then the idea of flexibility, because I think that that's something that we've struggled with across the country, that most care is 8 to 5 or whatever, and for people who work shifts or single parents, it makes it much more difficult. But if we could figure that out in Addison County, maybe we could be sort of lead the rest of Vermont and provide some ideas for the rest of the country.
Great. Well, thank you all so much for joining me today.
Can I jump in, Darla, with one other thing, which is, so we actually have come up with sort of a 4-point agenda of things that we think would make a huge difference. The first is, we think if we had universal health care that did not put a burden on employers. When we did the surveys last year with employers and asked if you didn't have to pay for healthcare, what would you do? Most of them said higher wages. And the second thing is this hope that eventually pediatricians are going to be able to prescribe high quality early learning programs, whether that's home visiting or in a child care program. We call it nurturing care from pregnancy to preschool. We would love to see universal preschool, which for full day, full year, the way states like Alabama do it. We still need wraparound childcare for that, but it would equalize the wages for caregivers. And then right now, what's happening is looking at our school districts and our towns working together to promote really this concept of whole community. So that's our agenda for the year, or maybe for the next year or two.
Great. Well, thank you all so much for joining me today. And all of your contact information will be available on the screen, as well as the Early Care and Learning Partnership website, where there is just so much information to be shared there. I, again, appreciate your time, and thank you very much for joining us on Growing Bright Futures.
Thank you, Darla.